I hope that you are preparing for winning proposals. Today we're going to go straight into pricing strategies and negotiation tactics. We will be looking at some contract tenders that you can, some portals that you can go onto to look for particular contracts for your organization. So, hope everyone's doing well. So, did you know that 70% of businesses are producing ineffective proposals, pricing, and their negotiation? And this is the primary reason for them losing a lucrative contract opportunity. So do you know, like I said, did you know that 70%? So let's get into some strategies for success for you for winning your proposals and pricing strategies and negotiation tactics. So when you're looking to prepare to win a proposal, so you're preparing your proposal, for example, you need to understand the importance of research, thorough research in crafting a successful proposal. Now, remember that I said to you that it's important that you speak with your community, because your community will tell you what they need. Yes, of course, you speak with the government organizations, but the organization still has to get the information from those that need the service. So speak to your community, because they will then be able to really give you some really good insights as to what you need to provide them with. So thorough research is one of them. So when it comes to contracts, healthcare contracts, whether it is between the providers, for example, and insurance companies, who it is that you want to work with, healthcare facilities, suppliers, etc., you as the organization want to ensure that you're able to meet the government agencies. So careful research is paramount to you to really know the specifics of why this research is crucial. Why do they need to use your services? And I'm going to go into this and I'm going to break it up step by step. So first thing, you have to understand what the client needs are. So there's research allows you, the care provider, to understand the specific needs that the buyer is wanting from you. So this is to do with preferences of clients, for example. So when you're a healthcare facility and is seeking a contract with a company like the buyer, for example, it could be a government organization, it could be a care home, for example, private hospital. You want to do the research of the demographics in that location, because you want to know what the population is so that you're able to discuss this in your contract. You want to know what the health issues are and the coverage preferences. This can also inform the proposal content and structure. So sometimes when you're working with insurance companies, for example, then they will tell you what the cost that they're allowed to go up to and what they will cover. And it's the same when you're working with government organizations as well. So bear that in mind. So who is it that you're looking to contract with? Is it a government organization? Is it a care home, for example, or is it a insurance company? So you want to do a complete market analysis and research the competitive market trends. It's so essential for you as the healthcare organization that's seeking the contract. You want to understand what the offerings are. Look at what the competitors are doing. What are their pricing strategies? Pop in and go and see them in their offices, for example, or give them a call and see what they are pricing, what they're charging, for example. What new trends are coming up? Is there, because it all depends on the location of where you are, as well, because sometimes it can be to do with the environmental, that there seems to be more of a need of a particular type of service due to the environmental and the location, for example. So this will enable you as the organization to position yourself effectively and to tailor your proposal to stand out in the market. You must ensure that you are meeting compliance and regulations. What are those requirements? What is it that they requiring from you? Do you need to be registered with a licensed body, or do you need to just have the relevant insurance and staff members are compliant and up to date and DBS, etc.? So find out whether there's any compliance and what the regulatory requirements are, because if you're not registered with the Care Quality Commission, for example, or the government that you want a license with, then, and part of that contract is that you're licensed, then there's no point in you going any further, because they would just close you down, for example. They won't use you. So you want to do thorough research. Why? Because it ensures that your proposal is aligned with the relevant laws, regulations, and the industry standards. So this could include, if you're in America, for example, legal frameworks such as HIPAA, which stands for Health Insurance Portability and Accountability Act in the United States. In the UK, we've got the Care Quality Commission, for example, but also we've got the insurance where we have to have our employer's liability, public indemnity, professional indemnity, for example. And there's also the GDPR, which stands for General Data Protection Regulations. So another thing for you to consider is the buyer will want evidence-based approach. So this is where the healthcare is increasingly driven by evidence-based practices. So research allows providers, yourselves, to incorporate relevant data, studies, and outcomes into their proposals. Now, I've mentioned where it's okay for you to use a case study that you've seen that someone else has used and has gathered the information, for example, and it is being used by the councils or in the community, for example. So it's okay to use that as well. So you also want to look at the credibility, your credibility of the proposal, and also that it instills confidence in the potential client or partner. So that's from the buyer's perspective. Another thing that you have to consider is financial considerations. Researching financial aspects such as what are the cost structures, reimbursement rates, budgetary constraints is crucial in healthcare contract negotiations. So providers must ensure that the proposal is financially viable for you, because it may be viable for a large organization, but it may not be viable for you as a micro organization. So you could possibly be a micro organization or a small to medium-sized enterprise, for example, or a large organization or a charity organization. So it all depends on the organization and what the financial budget is that you have, for example, to be able to put forward for a contract. So look at the contract itself and then look at tailoring the solutions, whereby every healthcare contract is unique with its own specific requirements. So one care contract could be, we require support workers, mental health support workers, for example. Another contract could be, we require healthcare assistants to do personal care. Another contract could be, we require nurses to do nursing care in a care home or in the hospital, for example. So look at the contract, see what is specific, what are the requirements, what are the objectives, what are the constraints. Research will enable you to provide a tailored solution so that you're able to put forward that proposal to address their distinct needs and challenges of each client, the buyer, for example, that you want to partner with. So think about this. I hope everyone's got a notepad and paper. Just drink my water. So think about you customizing and demonstrating your staff members and your organization. What is it that you can demonstrate to the buyer? Okay, the buyer, they have concerns, and it is increasing the likelihood of a successful contract outcome if you can meet that need. If you can have that advantage, if you do your research, you can be the 30% who wins that contract, because the 70% of people aren't doing it properly, for example. So do you want to be the 30%? Type in hashtag 30% winning the contract, for example. Okay, so you've got a good advantage if you do your research. So going on to another section here, which is key elements of a successful proposal, and I call this part 2. Essential components of winning a proposal. It outlines the following. You've got to have a clear problem. You've got to have a solution overview, detailed scope of work, timeline and milestones, budget and pricing details, and a compelling value proposition. And I'll break this down one by one. So a clear problem. So healthcare business need to have a clear problem statement that addresses the pressing issues or challenges that the buyer or the broader healthcare industry is facing, because you need to have that. So a problem solution, for example, a personal problem statement can be, in our healthcare organization, we have identified a significant increase in patient readmissions within 30 days of discharge, particularly amongst elderly patients with chronic conditions such as congestive heart failure, diabetes, etc. And despite the efforts to improve care coordination and discharge planning, these readmissions not only result in, it indicates potential gaps in our post-discharge care processes. It's addressing this issue is crucial to enhancing patient outcomes, reducing healthcare costs, and ensuring the sustainability of our organization. So that could be a hospital, for example, whereby they are trying to prevent readmissions because it is more costly to have someone in hospital day by day because of all the resources that's being used than having someone at home or in a care home, for example. So the problem statement, it clearly articulates the problem, doesn't it? Yeah, there's a specific issue, patient readmissions. It's identified the affected population, which is patients with chronic conditions, for example. It also highlights the impact on the organization, the hospital, for example, or the council. So the resource strain and potential gaps in the care processes. So the emphasis and the importance of addressing these issues for various reasons is that this clearly sets the stage for you developing a targeted solution and intervention to mitigate the problem and improve overall performance in the healthcare business.